Hello, I'm Dr. William Schiff, urologist in private practice. What I want to talk about briefly today is cystoscopy, looking inside the bladder. This is no different than getting a temperature taken or getting a blood pressure taken or even getting a chest x-ray to help evaluate what's going on medically. In urology, my world is problems with the bladder, the prostate, and the urethra. To do this, we can use some numbing jelly to place in the urethra, the tube that men and women urinate through, to help this procedure be more comfortable. The procedure is done in an office very similar to this, with a scope that usually is flexible, a scope or a small camera that allows us to navigate through the anatomy, the urethra, the prostatic urethra, and into the bladder. This image will show up on a monitor such as like this in the background. Let's look at some frequently asked questions.